One of the most difficult topics in electrocardiography is white coarse complex tachycardia. So we are going to give you an approach how to diagnose white coarse complex tachycardia and how to manage in this particular lecture. So as far as the ECG is concerned, when the people started reading ECG, when they start reading depolarization, repolarization, they went away from cardiology and became a gastroenterologist, neurologist, and so on. So people who have crossed that stage, who have come to electrical axis, went away from medicine, they became surgeons and gynecologists. But people who have crossed that stage, who came to arrhythmias, ran from medical college itself, they became engineers and auditors. So that type of difficult topic is going to be the white coarse complex tachycardia. So we are going to go through this plan for this lecture, namely we define what is white coarse, we classify the white coarse, then we give the ECG approach management and give you takeaways. The definition of narrow coarse white coarse complex tachycardia in contrast to narrow coarse complex tachycardia, heart rate is more than 100, all right, but the QRS duration is more than 0.12 second. QRS duration is more than 0.12 second or 120 milliseconds. So that is the definition of white coarse complex tachycardia. So just like we classified the narrow coarse complex tachycardia, we classified white coarse complex tachycardia into regular narrow QRS and irregular narrow QRS. Regular white QRS and irregular white QRS. Regular white QRS, the commonest is being ventricular tachycardia, or it can be a supraventricular tachycardia with a pre-existing bundle branch block, what we call as a supraventricular tachycardia with aberrant C, aberrant conduction, or antegrade conduction of a supraventricular tachycardia through the accessory pathway, which is called antidromic tachycardia. So these are the three types of regular white coarse complex tachycardia. The commonest cause of irregular narrow coarse complex tachycardia is once again atrial fibrillation, but atrial fibrillation with a pre-existing bundle branch block. So atrial fibrillation with a pre-existing bundle branch block, or atrial fibrillation conducting antegradely through the accessory pathway, which is called antidromic AF. So these are the two important causes of white coarse irregular tachycardia, and most dangerous arrhythmias are polymorphic ventricular tachycardias and torsades pointus due to long QT interval. So this is a classification of white coarse complex tachycardia. So white coarse complex tachycardia, the commonest is being the ventricular tachycardia. Here a ventricular ectopic pacemaker is firing rapidly. So the impulse from the ventricular ectopic pacemaker has to go through the muscle to depolarize all the other areas of the ventricle. So naturally the ventricular tachycardia will have white coarse. But another important cause of white coarse complex tachycardia is that although the supraventricular tachycardia is happening like atrial, AVNRT or AVRT or atrial tachycardia, if the patient already has a pre-existing bundle branch block. I told you in a lecture on bundle branch block that basically bundle branch is diagnosed when your sinus rhythm has got white coarse. So in sinus rhythm itself they will have white coarse. So in the presence of a supraventricular tachycardia also, the supraventricular tachycardia beats also will be conducted through one bundle and come to the other ventricle through the muscle. So they will also have white coarse complex tachycardia. Although it is supraventricular tachycardia, if there is a pre-existing bundle branch block, they will have white coarse complex tachycardia. The next important cause of white coarse complex tachycardia, about the accessory pathway I told you, in orthodromic tachycardia we see at like AVRT, the antegrade conduction was through the normal conduction, retrograde was through accessory pathway. This is called orthodromic, which was narrow. Whereas in antidromic tachycardia, the supraventricular tachycardias, supraventricular impulses will come antegradely through the accessory pathway and go retrogradely through the normal pathway. Because accessory pathway is connecting the muscle, because antegrade conduction has to go through the muscle, so this will result in a white coarse complex tachycardia. So antidromic tachycardia can be an atrial flutter with antidromic tachycardia, or a atrial fibrillation with antidromic tachycardia. So antidromic tachycardia also result in white coarse complex tachycardia. So among them the commonest is ventricular tachycardia, followed by supraventricular tachycardia with the bundle branch block, followed by antidromic tachycardia or pre-excited tachycardias. So once you have, so this is a white QRS complex tachycardia. So once you diagnose it's a white QRS complex tachycardia, it is called non-sustained white QRS complex tachycardia when it is lasting less than 30 seconds. A bout of tachycardia, then the sinus rhythm comes. A bout of tachycardia, sinus rhythm comes. Then it is non-sustained. A sustained white QRS complex tachycardia is sustaining more than 30 seconds and many minutes or many hours the tachycardia goes on. So it is sustained white QRS complex tachycardia. Then in the white QRS complex tachycardia, you must see in a given particular lead whether all your QRS complexes are of similar configuration. So you look at L3 here, all my QRS complexes are similar. So it is a monomorphic white QRS complex tachycardia. So it is a monomorphic. From single focus, the ventricular tachycardia is being fired by a single ventricular ectopic pacemaker. So it is monomorphic. Whereas look at this white QRS complex tachycardia here, each QRS complex is different in height, different in direction, different in width, and different in aberrancy, different in notches, and different in amplitude also. So this is a polymorphic white QRS complex tachycardia. So most often it's a Torsady pointus. Then the classification of white QRS complex tachycardia depends upon whether the V1 is positive or the V1 is negative. If the V1 is positive, where you get V1 positive? In a right bundle branch block. So whenever V1 is white QRS complex tachycardia with a V1 positive tachycardia is called RBB type of white QRS complex tachycardia, because V1 positive white QRS complex tachycardia called RBB type. Whenever the QRS is negative in V1 and the QRS is positive in V5, V6, it is LBB type of white QRS complex tachycardia. So it can be RBB type where the V1 is positive. It can be LBB type where V5, V6 are positive. So ventricular white QRS complex tachycardia has got so much of classification depending upon. So we classified whether it is VT, SVT the aberrancy, or pre-excited tachycardia, whether it is sustained or non-sustained, monomorphic or polymorphic, RBB type or LBB type. So this is the classification of white QRS complex tachycardia. Then we come to the approach, the diagnosis of white QRS complex tachycardia.